Hi, everyone. My name is Dr. Rita Roy, CEO at the National Spine Health Foundation, and I'm your host for the Get Back to It podcast, where we tell real stories of healing and recovery. What does it mean to get back to it? It means overcoming injury through treatments that work in order to return to the people and activities you love, whatever that looks like for you. It means getting back to your life. We're here to share the success stories of those who did just that. And some of these stories you are not going to believe. At the Get Back to It podcast, our goal is to tell stories of spinal champions who've been able to achieve a better quality of life through spinal healthcare. In today's episode, I am delighted to be speaking with Jenny Jones, who began having some leg pain almost 25 years ago, which she thought may be caused by skiing with her kids. Things quickly became worse, and eventually an MRI in 2002 revealed a condition of the spine called spondylolisthesis, instability of the spine, for which she had surgery in May of 2003. 5 years later, she began to experience numbness in her arms, for which she had to have surgery on her cervical spine. Now she's doing all the things she loves, including skiing and living her best life. Now that you know what to expect, let's get back to it and dive right into Jenny's story.
I would talk about my spinal surgery, and my symptoms started around the year 2000. It was a long time ago, so that's a kind of a date that sticks in my head. My pain started, and I had young children at the time, and I really thought that was related to lifting kids, using heavy ski bags, pulling kids on skis, just general being busy and a busy mom. But after a fall in my hallway here at work, and then the pain when standing, I remember standing at my middle daughter's volleyball game at school. There was no seats available. My husband had to help me even get to the car because I just had numbness in my legs and pain in my back. It was so bad. It was just horrible.
Jenny thought her discomfort was just muscle pain, but in 2002, she started dragging her right foot and tripping. Standing also became an issue. While trying to get ready for the Boilermaker run in July of that year, she was about 2 miles from home when her right leg went completely numb, causing her to fall.
It was early Sunday, and I remember that specifically, that it was Sunday because the traffic was very light where I was out running. After I fell, I was really hoping someone would pass by on their way to church and see me on the side of the road. It felt like 5 minutes. I'm sure it was probably just a bit less, but I got up and remember thinking, why can't I walk? My leg is so numb. I finally realized I was able to jog because the gait is different when you jog and your weight is forward. When I got home, so I was kind of scratched up and a little bloody, and I got home, my husband's like, are you ever going to make a doctor's appointment?
Jenny saw her primary care provider, who told her it was probably just arthritis, and told her she needed to run on a soft surface. Ultimately, though, her primary care doctor ordered an MRI.
Yes, because of the numbness and the very pronounced limp that I was able to demonstrate, I was just really insistent that he order an MRI. And remember, 20-something years ago, MRIs weren't ordered a lot. I'm glad I had a good relationship with my PCP that he would do that.
The MRI was consistent with the diagnosis of spondylolisthesis, which occurs when one or more of the vertebrae, the bones of the spine, slips out of place onto the vertebrae below it.
My doctor referred me to a neurosurgeon somewhat locally, and that neurosurgeon, I remember saying, do you just want a disability note? That way you don't have to work again. And I thought, that's not me. That's not going to happen. So I went back and asked my PCP to find a referral to another neurosurgeon so I could get a second opinion. And that physician recommended surgery at my first visit, and I had the surgery a few weeks later.
Jenny's surgery took longer than expected, and she was in the hospital for 4 days.
Yeah, the surgery took about 6 hours because the slip in my back, in my vertebrae, was worse than expected. Back then, they used to put cadaver bone in people or take a chunk out of your hip to use in your back. But back then, there was a new substance. They called it a biologic substance that I was told was similar to glue and would help bone grow. And so they infused that. So my recovery time, even from a few years before, was much better. At that time, my neurosurgeon told me I had a grade 4 slip and that the vertebrae at the bottom of my back had disintegrated.
Jenny's recovery took about 6 weeks, and at the beginning was pretty uncomfortable.
It was very uncomfortable, even in the hospital. Getting home from the hospital was hard. My kids remember me having to use an office chair on wheels to slide, even to to get to the dinner table. I laugh and tell people silk jammies helped me roll over in bed because it was just so hard to roll because my surgical scar is pretty long there. I had to return to work with a back brace and a bone growth stimulator, and I didn't require physical therapy after the surgery. I kind of bounced right back.
Jenny was eventually able to enjoy skiing again, but selects the less challenging trails and just takes it a little slower. Flash forward 5 years, and she began to experience numbness in her arms.
Yeah, the numbness I began to experience in my arms was troubling, and it got worse at night laying flat on my back. I went back to my PCP, and she sent me back to the same surgeon I had been to before. And then that surgeon prescribed some steroids that helped with some inflammation that helped me for a short period of time.
The numbness became constant, however, and in 2008, she had a laminectomy at level C3, C4 with physical therapy as part of her recovery plan.
Yes, my neck still feels tight very often. I just do stretches, sometimes even during meetings on WebEx and things. Now I'm 60 years old and I'm 20 years since my first back surgery. I'm still very active with skiing. I helped build a cabin in the woods with my husband. I've cleared land that we've purchased. And I also enjoy spending time with my grandbaby when I get time to see her.
That is amazing. Jenny, your story is so amazing. And it's an important story to tell because it shows the level of success that can happen with quick action and persistent action, I would say. You know, I'm really taken by your persistence in trying to find the right doctor when it came to, you know, your back issue that you had, the first issue you had with the low back pain and numbness down your leg. And you got to that first doctor and you just knew that was not right for you. Can you talk to us a little bit about that? How did that feel? Were you nervous? Were you uncomfortable? Were you confused? Tell us about that experience.
I guess maybe the word would be a little angry. I was 40 and very active. And to hear a physician say to me, well, I can give you a note and you never have to work again. You know, you can stay in like the Barca Lounger. And I thought, well, that's just not in my plan for my life. Right. That's going to happen. In my day job, I work with people that have disabling conditions all the time. And I never thought I was going to be that person.
Wow.
And I just remember saying, yeah, that's not going to work for me. And he was insistent that surgery was the wrong option, that was the worst thing that could happen.
Oh, my goodness. And did he explain to you what his basis for that was?
He indicated he didn't felt that it worked. So that made me wonder about his skill level.
Yeah.
Don't do surgery. It's horrible. The recovery time is horrible. It never seems to work. So I went back to my PCP. Well, actually, let me recollect and take that back a little bit. I was going to go back, but they canceled the next several appointments in a row. And so then I was really kind of fed up, right?
Wow.
That's not Yeah, you can't keep doing that. And I was in a lot of pain at that point.
Yeah.
So I called my PCP and I'm like, you got to find me somebody else. Like where I don't know where to go or who's competent. So you need to help me with that. And they did. I remember my PCP saying, well, there's a guy I've heard of in Syracuse. So I'm going to send you down there. And then you tell me how this goes and if it works well before I'll refer somebody else down there.
Oh my goodness. So it sounds like you had a great relationship with your primary care provider, your PCP.
Yes. I'm from a small community where I live. And so I actually get to interact with him professionally as well in my work life. And we shared a lot of clients in common. So really good relationship, but a really great primary care doctor. Yeah. Hold all my doctors to his standard now.
That's fantastic. That's such a blessing to have that.
Yes.
And I think, we think about the history of what has occurred in modern spinal healthcare. And 20 years ago was a real turning point when things started to really be great for patient outcomes. The evidence development had happened, the technologies that were available for patients were there, the biologics that you talked about, bone morphogenetic protein and so forth that could offer patients, new solutions. And, you found your way to a surgeon who had the skill and the knowledge and the training.
Yeah, I did thoroughly check him out. Data is much easier to find nowadays about physicians, but even back then searching, I'm in New York State. So through the Department of Health websites, checking for, any claims that were out there, lawsuits. I went in and did my due diligence. This is a big surgery. And you want to make sure you're confident in the person doing the surgery.
Jenny, that's so amazing that you did that research. And yes, 20 years ago, there were not reviews on Google or things like that. So you really had to dig harder to do that. What I think is so remarkable about that is, we often talk to people about the power of getting a second opinion. It's important. Educate yourself, understand who is going to operate on you, have a relationship that you trust, really trust that person. But when people are in pain or are uncomfortable or having the numbness, you don't even want to do that, right?
No, you're desperate.
You're desperate. You just want to get it over with. You just want to get back to your life. You're just like, I don't want to take the time I don't have the time to do that. I need to get better. But yet taking a little bit of that time up front is so important to the long-term positive outcome that you're going to live with, right?
Yeah. And I think you have to have that attitude that it's going to work and you're going to have a good outcome. Understand and expect there's going to be discomfort and pain and you're going to be nervous. This is a big surgery and you're really hoping, praying that everything goes right. But really, I had the expectation of 100% recovery, back to 100%. And my neurosurgeon indicated at the time, he goes, I got you to 95%. Like, that's better than probably most everybody else.
Yeah, that's awesome.
Yeah.
That's awesome. But that expectation is so important, the anticipation of success, right? So you do the things to make that happen. And that means informing yourself, educating yourself, choosing the right doctor. I'm so excited to know that it has been over 20 years and you really don't think about your back surgery.
No, I really don't. Outside of having to give up snowboarding, that was the big one because of the torque when you fall is pretty significant. I really don't ever think about my lower back at all. It doesn't bother me at all. You and I talked before we were broadcasting. I have a daughter that works for an orthopedic company or used to work. And her friends always ask me, is your back still okay? How in 20 years are you still able to go run or move about and really have no limitations outside of not supposed to ski, but life's a risk.
Exactly. I ski too. I'm very proud of the fact that after my surgery, I'm only 5 years out and I ski. I take it slow, but I get on the slopes and I get up there and
It's a wonderful feeling to be out in the fresh air and the sunshine and just have a day. It's
just have the day and doing something you love doing and enjoying it with your family. And that's what life is all about, right? It's just living those wonderful moments. I think, as we age, inevitably we are going to be doing less, less difficult slopes, right? Less difficult. And so that's going to happen anyway. So just being able to be out there, figuring out what's the appropriate level of activity and going for it and enjoying it that's the blessing of modern spinal healthcare that we talk about and celebrate here at the National Spine Health Foundation. I do think it is amazing. You're probably the first person I've spoken to on the podcast that's 20 years out.
Oh, wow.
And it's amazing. I'm so excited.
I mean, surgery really does work, and it fixed what the issue was. And I know I'm probably lucky to be 20 years out and not have to repeat with the hardware that's in my back. But it really gave me my life back. I was preparing for this and looking back how significant the issues were, and I kept making light of them for a little bit, but they got so significant that my activities of daily living were really poor. Like I had trouble getting shoes on. I had trouble, getting pants on and things like that. And so this really gave me my life back. Yeah.
Well, that's fantastic. We talk about people feeling like life as they know it has come to an end. Mm-hmm. People say, well, spine surgery, you're not saving lives. And we say, yes, we are.
Yeah, I can't imagine if, 20 years ago, if I had taken the advice of the first physician and just choose to sit in, a lounge chair and maybe not work anymore and not, be disabled, draw a disability check. That's not where I wanted to be in my life at all.
Yeah.
So I'm glad I took the time to just say that's not going to work for me. Let's find somebody else. So
yeah, that supported you in that desire to get another opinion and to find a different opinion.
Mm-hmm. Yeah. And I remember my primary care doctor calling me at home. You say I've got a good relationship.
Yeah.
And after the MRI came in and he said, "Oh, it's not arthritis." This is serious. And for my first thought as humans, I'm like, oh, what is it? Cancer?
Yeah.
Not that bad, Jenny. I'm like, oh, good. Okay. But still not great. And, it ended up being significantly, the slip was worse than we thought. So,
yeah. Well, one of the other lessons in your story, Jenny, is that people will often say to us, I know the technology is just going to get better and better, so maybe I should wait. I should wait for the technology to get better. And we say, do not delay treatment. Yes, technology improves, but it is really good right now, and it will get you back to life. Why throw years of your life away and risk permanent damage, nerve damage?
Yeah, I between the 5 years between the lower back surgery and my cervical surgery, just a bone growth stimulator, and it changed. I had this massive thing I had to wear for my lower back. And 5 years later, when I had my neck surgery, it was just a little electrode-y thing. Yeah. Now they don't even look like that. It changes constantly and quickly.
Yeah. But that's not a reason to delay care because the technology is really good. Yes, it gets better, smaller, faster, cheaper, all those things. But the care that you get, what it will do to repair your body is good and has been good for a long time. I think that's one of the lessons, I think, in your stories. Don't delay care because you think something better is going to be invented or come down the road.
Right. Through my job, I've been able to talk to a lot of people, I would say, that have had back issues and try to alleviate that fear, because if you don't go and educate yourself and find out what's available, doing nothing doesn't work. So, keep moving forward. I get the fear and I get the trepidation of, oh my gosh, this could be a major surgery. But until you go and find out what's really wrong and do your due diligence, you really don't know.
Right.
So educate yourself and find out what's your best options and make sure you have options.
And having the options, that's such a good point. I mean, that's what we are so dedicated to doing here in the foundation, is making sure that people have the right access to the information they need to educate themselves, to empower themselves, to know what the options even are. I don't even know what the options are. I don't even know what questions to ask, right? So it's like, here are the questions to ask. Here are the treatment options. Maybe you don't even have the right diagnosis. Make sure you've got the right diagnosis. Is it arthritis? Is it a spondylolisthesis, right? Let's get the right diagnosis, find the right treatment, find the right provider. So those are big decisions to take. And the National Spine Health Foundation is here committed to helping people along that journey. One way we do that is by talking to people like you who are willing to share their stories.
Yeah.
So,
I mean, I really encourage people to just, keep going and find a doctor that you're comfortable with and that you have confidence in, that's going to give you the right information and help you take a look. I remember my first visit to that neurosurgeon's office. I actually saw an older physician who ran the office part, and he said, "I've got the right person for you for this surgery." And I think there was about 5 or 6 neurosurgeons in this practice that I went to, but I remember him saying, "I've got the right one person for you that I know can help you." And his confidence gave me confidence.
That is such a good point, because we've messaged in some of our other programs that, spine surgery is like many fields, becomes specialized, right? So there could be a surgeon who does spondylolisthesis surgeries, doing fusions all day. There might be another surgeon who's doing disc replacements, another surgeon who's doing scoliosis or deformity surgery. So you want to find the surgeon who is really good at doing the thing that you need, and who does that kind of thing all the time, right? And so that was so comforting that you had a surgeon who said, I do X, you need Y, and I know just the right person to do the Y for you. That's amazing.
Yeah. Obviously a great practice then, and they've had good outcomes, good enough that I went back 5 years later when I needed to. I actually saw the same surgeon again. And I remember him saying, "Well, you got through the one 5 years ago. This is nothing."
Oh gosh.
This is a breeze now.
Yeah.
So, this more scary thing I think about the neck surgery is this surgeon went through the front. I just assumed they would go through the back, so I have a little scar, but that didn't really matter at the time. But I remember I'm like, why would you go through the front? That one, there was only one slight problem with my cervical surgery was the swelling post-surgery. I lost my voice for about 30 days. And I'm a talker.
Oh, yeah. So that wasn't fun. Maybe.
No. Yeah. My kids would laugh, but I had to get a bell near the chair in order to tell somebody I needed something, because it just really wasn't there. But then it just finally, the swelling or whatever went down and my voice came back. And then that's why I didn't return to work as quickly, as I just needed to get my voice back.
I see. And Jenny, what kind of work do you do? Can you share with us what you do?
I am the commissioner of a local Department of Social Services in New York State. So we do child protection, adult protection, SNAP, Medicaid, public assistance.
That was amazing. What good work you're doing.
Thank you.
Community. You definitely need your voice for that work.
Yeah, a lot. So, but I've had lovely opportunities through my job to talk to lots of people, or, people that are, especially in our adult protective world, people that are afraid about surgery and their health. And, it has come through to some of them, and our public health, my friends at public health nursing. Well, you had this. Can you talk to somebody because you had a good outcome? Because you always hear about the ones that went wrong. And people like me that you can't even tell I had surgery, people forget about, because you can't see it. You don't see me limp and walk and complain because I don't need to.
Right. And again, that's what we're trying to do here, is to tell and celebrate these wonderful success stories, because when you get fixed and you move on with your life, you've moved on.
Right.
But it's folks that have had not a good outcome who tend to talk about that bad outcome. Right. Here's sort of the complaints, where then you hear the good news. And so that's what we do, is we tell the good news, that there is more good news than not good news.
Absolutely.
Spinal healthcare. And that peer-to-peer support, where people say, I just want to talk to someone who's been through this, or I want to hear from someone who's been through this. That's so powerful and so important. I know I myself felt that way when I became a patient, and I was a mother, and I had active kids, and I thought, gosh, I got 6 weeks of no bending, lifting, or twisting. How am I going to get through that? I want to talk to someone. I need some advice from a mom who's done this.
Exactly. I know I learned to kick the laundry. They tell you don't lift, right? So I kicked the laundry down the hall, down the stairs, down to the laundry room, also I plan to recover. And so I was just going to figure it out.
Right. So you had the expectation that you were going to get better, and you were going to figure that out. And that somehow manifests that, right? That's fantastic. Yeah. Mm-hmm. I had similar questions about laundry, but more importantly, emptying the dishwasher.
Yes, I had trouble with the dishwasher, because you got to lift.
I remember putting it down. Like, putting it down in the dishwasher was kind of easy, but it was more like bending down to lift it up. I was like, I'm not sure how I'm going to do that.
Yes, I do remember that came up, and I think I acquiesced on that, and told my husband or my daughter, you're just going to have to do that till I can. Yeah. So. But 6 weeks go by fast.
Tell me, can you remember what your recovery was like after the fusion surgery?
For my neck?
For your back.
For my back. How long the recovery was?
Yeah.
Well, I was in the hospital, like I said, longer than I anticipated. I was back to work in about 7 weeks, but I had to wear this brace thing for like 2 to 3 months. And I remember being told to be very careful for a year, that it would take about a year of healing. And so that was May's surgery, back to work. And given what I do and I see the public, I remember a lot of people like, what is that you're wearing? Because it was like a iron corset back then.
Yeah, like a brace.
And so people asked a lot of questions, and that was good. But I remember being really careful. And then I live in northern New York. We get a lot of snow and ice. And that like November, I remember I walked out the back door and I slipped and I fell. And I thought, that's it, I'm paralyzed. And then I sat, I'm there for a minute and I'm like, wait, I'm fine. I can get up. And I was okay. So, I was very nervous. But, from having surgery, like there was things I couldn't do for a while that I forgot about, like tending the flower beds and things like that. So the next summer and spring, when you get out there and you realize like, oh, shoot, nothing's been done for, a year.
Yeah.
Kind of getting back and getting things under control. I was lucky, like in order to leave the hospital, I had to prove, I went with physical therapy and walked up a flight of stairs, one leg, then the next, one leg, then the next. Now I was 40 and very healthy. So I remember saying, can I just walk up the stairs? They're like, if you can. And I just zoomed up the stairs. So they're like, then you can go home because you can but by the time I got home, I'm an hour and a half, 2 hour drive from the hospital. It was an agony to get home. Right. And I was exhausted.
Right.
You're on a lot of painkillers. Right. And the side effects of painkillers,
Yeah.
Trying to take a shower. Oh, that was to get it. You're not getting into the bathtub because you can't get back up. Right.
Right.
And, so full disclosure, my husband had to help me for the first week.
Yeah.
Was to stand in the shower to try to get clean. He had to help me with that and help me get my shoes on, help me get my pajama pants on and things like that. Cause they're really, the scar on my back is probably 4 to 5 inches there. So there was a lot of, stitches, staples in there. Right. Right. So bending was just not going to happen.
Right.
And I had some trouble with the painkillers, the nausea that can sometimes come with, painkillers, and sick.
Yeah.
I was very sick from anesthesia. So even though the surgery took some more hours than thought, I was in recovery for many, many hours after because the anesthesia.
Because they had to have such a longer surgery, probably, right?
Well, yeah, and it just made me very sick. That's my first recollection, is just as soon as I woke up, I'm vomiting.
Yeah.
And I remember them saying, we've tried everything.
Yeah.
This is hours later, but it finally turned around.
Right.
And I was able to get back to my room at the hospital, but it's been 20 years and I forget, and I laugh about, being in the office chair to Zoom to the dinner table, but I really could not even sit in a chair and scooch it forward. I couldn't have done that. That's why we went to a chair on wheels, because you just couldn't do that motion.
Couldn't do the motion. Yeah. Things have definitely improved in post-surgical, outcomes. And yet, you went through that discomfort post-operatively for a short period of time to get your entire life back. I mean, I think that's the message, right?
Exactly.
And Jenny, as you and I were talking about, you're like, gosh, I haven't thought about this. I forgot. I've got it. Let me put my memory cap back on and try to remember what it was even like. And that's just such good news. You get through it, you get past it, and then you forget what it was like.
Yeah, you just got to look where you want to be. Like, what's your expectation and where you want to be, and you can deal with almost anything for a short period of time, and then you move forward. It's so worth it to to be able to move and breathe and make a plan and do what you want.
Yeah, live life on your terms. Right?
Exactly.
Live life on your terms. Own your life. That's what we all want. Let's see, Jenny. I guess we didn't talk about with your neck surgery. What was that recovery like? Was it different than?
Oh, it was outside. I mentioned earlier I lost my voice for about 30 days.
Right.
The neurosurgeon was correct. It was much easier than my lower back. He told me to read, I think it's called the neck book that I have to make sure I continue to do some stretches. I am not in healthcare, but I think because it's so much smaller up in your neck, my neck gets stiff. I would say it's not debilitating in any way, but I got to make sure I sleep a little, right, got the right pillow, that kind of thing. So I was out of work for 4 to 5 weeks is all. And then I just returned to work. But again, I had to wear a neck brace. I don't know if they even do that nowadays. So, I wore a neck brace to work for a while, but the pain level was much less significant than my lower back. I remember getting a prescription for, I think, probably something crazy like 120, 150 oxycodone. And I was like, yeah, I'm not feeling that.
Wow.
That's what, that's just about this time things were really starting about opioid issues. And given where I work, I was like, oh no, I'll be addicted. I'm afraid of taking that. So I would say after a couple of days, I just stopped with that and just moved to like Motrin.
Yeah. Or Tylenol.
Because it was much more tolerable.
Yeah.
I did have one little setback, and I think it was just from swelling from the surgery where it felt like something was pinched and called, and they just gave me another steroid pack, and after like taking the steroid the first day, whatever swelling went down, and then that released that pain, and then my voice came back. So
magic.
that was magically good. Again, I didn't need any they did have me do some physical therapy afterward for my neck. I just went to our local physical therapy department and did some exercises around stretching and strengthening your neck. And I did that for probably about 3 to 4 weeks. is all. Just worked with a physical therapist. It's funny, the other one was more major surgery, but the neck required a little bit more. It was a little more delicate. Mm-hmm. Had to be a little bit more careful about doing some physical therapy.
Right. And I think also with your low back surgery, you were in such good shape. I mean, a lot of times we find that patients do what's called prehabbing. So they get themselves in a little more in shape before the surgery, because the more in shape you are before the surgery, the better your outcome is going to be. And it sounds like you were in great shape, went into your surgery in great physical shape. And so then the need to do the recovery exercises is a little
I was
easier.
I was 40 healthy, trying to get ready for a race. That was the year, for me. But I did. I had a recumbent bike, and I did that in advance. I'm lucky that I have good health. And so I remember going into the hospital with the lower back surgery, and they're like, "Are you sure you don't take any medication?" And I'm like, I'm absolutely sure I do not take any medication. It was still the same 5 years later, but, suddenly I was old enough. I had to have EKGs and everything else. But it was just, I would say the difference in the neck is it's just more delicate. And you have to be a little bit aware of that. So my neck is a little fussier, I would say. That one I think about only because my neck gets stiff sometimes. Mm-hmm. But, like if I'm flying on a plane, long flight.
Right. The question is, would you be getting stiff anyway? Probably. Yes.
Probably yes. But I can use my hands and I can keyboard and I can, it's weird when it's that numb, right? And you're thinking, how is that even possible?
How is that possible?
My hands.
Isn't that weird? It's the weirdest thing. And you just can't even imagine what it's like until you've had it. And so when you try to explain it to people, they just don't get it. On the flip side of that is when you do meet someone who has had that, they're like, yes, I totally know what that means. I get that. I had that problem. And it's sort of a connection that you just want to share. You want someone to understand what you're feeling because it's so strange and so out of the normal.
Right. And then, by then when I went back to the same physician, my confidence was really high for him to do that. You mentioned about specialty, and I think probably at that time he was a younger physician. Mm-hmm. He's still in practice now. I looked him up, but he had mentioned he'd only done about 4 of the back surgeries per year that I had. He'd only really done about 4 a year. He said he did, hundreds of laminectomies, but not that many. But he had good outcome on all of his, he said. And I have family and healthcare down in some Syracuse hospitals. So yes, that to check him out on the side too.
Yeah.
And, to do your diligence.
But that's important. And our doctors will even say, chances are you have a neighbor or a family member that are in healthcare. Ask them.
Yep.
Ask them to ask about this doctor and make sure, because that's one of the best ways to know is that nurses who work in the hospital or folks who work, around will know. They sort of know who the good ones are, right?
Would you go to them or not yourself? That's usually, the question.
That's a good question. Mm-hmm. Well, Jenny, I so appreciate your time and talking with us and sharing your story. When you think back on it, what would you say to someone who might just be starting their journey? We've talked about a lot of pieces of advice that we give people to educate themselves, get a second opinion, trust their doctor. Or what sort of lasting message would you give to someone?
Educate yourself. Look for options. So, do your diligence and, don't use, I use good analytical websites. Nowadays you can do that and the good ones, right? Talk with friends and family, get a second opinion. In my case, I had been sitting on my fanny for the last 20 years. And if I didn't go get that second opinion, I don't know what my life would be like. So keep searching and don't give up. and you have to expect that you're going to recover. You have to have a positive mindset that this is going to get better, and not just get wrapped up in that it hurts today and the surgery will hurt more, because that pain will go away, right? That surgical pain will go away.
Yeah.
You can get through it. So if I can get through it, anybody can get through it.
That is awesome. Awesome advice and insight to share with everybody. Thank you for that. At the National Spine Health Foundation, something we believe in most is providing hope for recovery through sharing stories of success and expertise. It isn't always easy to find someone to relate to, even though 100 million adults suffer from neck or low back pain each year. To hear more stories of spinal champion recovery and access educational materials about spine health, visit us at spinehealth.org. If you're interested in supporting our show financially, you can contribute at the link provided. Thank you for listening.